By this point, if you haven't had COVID-19, you likely know someone who has. And healthcare workers, they're still trying to figure out how the virus impacts our bodies even after we recover.
One Ohio man is now in a wheelchair after having what doctors say appears like a rare reaction to the virus. This News 5 original, our Kevin Barry explains how it is testing what we know.
I took a shower back in March of 21 and didn't realize that I had my socks on because I couldn't feel my feet.
What started as Matt Close's bizarre lapse after he had COVID quickly became much more serious.
One Friday evening, I started falling, and I could not get up the stairs, and that's when I knew something was wrong.
Something. But Matt says even doctors didn't know exactly what at first.
Finally, I did have a doc that said, hey, there's multiple of you, and there's one common thread, and it's COVID.
That was roughly a year ago. Matt recovered from COVID, but he's been in a wheelchair or using a walker. He can't drive, and he's in intense pain because of nerve regeneration in his legs. Physical therapy is helping him improve, but cases like Matt's are making doctors like UH neurologist Dr. Kamal Shamali take notice.
We have to consider the long-term complications as part of the whole disease.
He says it's not unheard of for a virus to affect the respiratory system, at least for a little while. But Dr. Kamali says he's seeing people, vaxxed or not, seem to beat COVID before these conditions set in.
And then suddenly they started to develop those neurological symptoms, and within a few days, they were paralyzed, totally paralyzed.
And those issues linger for much longer than paralysis caused by other viruses. It's a big part of the reason politicians and now the National Institute of Health are throwing more funding at the problem for research, because even doctors with all the benefits of modern medicine just don't have many answers for patients like Matt.
Are these symptoms different between COVID post-infection and, let's say, another virus post-infection? We don't know that answer yet. And this is where research really has to be very active.
In the meantime, Matt goes to regular physical therapy, trying to figure out what comes next.
Because I am getting better. But it's been a long time.
In Cleveland, I'm Kevin Barry, News 5.